A molar pregnancy is a rare complication that can happen during pregnancy. It's not a normal pregnancy. Instead of a healthy baby developing, an abnormal growth forms in the uterus. This growth is called a mole. Molar pregnancies are uncommon, but it's important to be aware of them. They can cause a range of symptoms and require specialized medical care. The good news is that with early diagnosis and treatment, most women make a full recovery and go on to have healthy pregnancies in the future. To understand molar pregnancy, it helps to understand how normal conception works. When a sperm fertilizes an egg, the egg's chromosomes combine with the sperm's chromosomes. This creates a single cell with a complete set of genetic information, which then divides and grows into a baby. In a molar pregnancy, something goes wrong during this process. The chromosomes don't combine correctly, leading to the development of an abnormal growth instead of a healthy embryo. This can be due to problems with the egg or the sperm, and the exact reasons why it happens are still not fully understood. There are two main types of molar pregnancies: complete and partial. A complete molar pregnancy means there is no normal placental tissue or fetal development. The mole is entirely made up of abnormal cells. This happens when a sperm fertilizes an empty egg, which is an egg without any genetic material. On the other hand, a partial molar pregnancy involves some abnormal placental tissue and possibly some fetal development, but the fetus is not viable and cannot survive. This occurs when two sperm fertilize a single egg at the same time. The exact causes of molar pregnancy remain a subject of ongoing research and scientific curiosity. While we know some of the risk factors, the underlying reasons why a molar pregnancy develops are still not fully understood. Researchers continue to study the genetic and environmental influences that might contribute to this rare condition, hoping to provide clearer answers in the future. However, what we do know is that certain factors can increase a woman's likelihood of experiencing a molar pregnancy. Age is one of the most significant risk factors. Women at the extremes of reproductive age, such as teenagers who are just beginning their reproductive years, and women over the age of 35, are at a slightly higher risk compared to women in their 20s and early 30s. This increased risk may be related to changes in egg quality or hormonal fluctuations that occur at these ages, though the exact mechanisms are still being explored. Another important factor is a history of molar pregnancy. If a woman has experienced a molar pregnancy in the past, her chances of having another in future pregnancies do increase, although it's still considered rare. This is why doctors often recommend close monitoring and follow-up care for women with a previous history to ensure early detection and support if needed. Ethnicity also appears to play a role. Some studies have found that women of Asian, African, and Latin American descent may have a slightly higher risk of developing a molar pregnancy compared to women of other backgrounds. The reasons for this are not entirely clear, but may involve genetic predispositions or environmental factors unique to certain populations. It's important to keep in mind, though, that these are only risk factors. They do not guarantee that a molar pregnancy will occur. In fact, most women with one or more of these risk factors will go on to have healthy, normal pregnancies. Understanding these risks can help women and their healthcare providers make informed decisions and seek appropriate care, but it's equally important not to let worry overshadow hope and optimism for the future. In the early stages, a molar pregnancy can seem just like a normal pregnancy. You might notice the usual early signs, such as a missed period, a positive pregnancy test, and even some of the typical symptoms like mild nausea or breast tenderness. Many women feel excited and hopeful during this time, unaware that anything unusual is happening. However, as the pregnancy progresses, certain signs and symptoms can begin to indicate that something is not quite right. These symptoms may develop gradually or appear suddenly, and it's important to pay close attention to any changes in your body. Abnormal vaginal bleeding is often the first noticeable sign of a molar pregnancy. This bleeding can occur at any time during early pregnancy, and it may be mistaken for a normal period or spotting. The bleeding may be light or heavy, and the blood can range in color from dark brown, sometimes described as looking like prune juice, to bright red. Occasionally, you might also notice the passage of grape-like cysts, which are clusters of abnormal tissue. Severe nausea and vomiting can also occur, and these symptoms are often much more intense than the typical morning sickness experienced during a healthy pregnancy. This is due to the unusually high levels of pregnancy hormones produced in a molar pregnancy. An enlarged uterus is another sign to watch for. In a molar pregnancy, the uterus may grow faster than expected for the gestational age, making your belly appear larger than it should be at that stage. High blood pressure can also develop, sometimes even in the first trimester, which is unusual in a normal pregnancy. This is because molar pregnancies can cause a significant increase in blood pressure, and may also be associated with symptoms like headaches, swelling, or visual disturbances. If you experience any of these symptoms, especially abnormal bleeding, severe nausea, rapid belly growth, or high blood pressure, it's crucial to consult your doctor immediately. Early diagnosis and treatment are essential for your health and well-being. Early diagnosis is absolutely crucial when it comes to successfully managing a molar pregnancy. The sooner a molar pregnancy is detected, the better the chances are for effective treatment and a healthy recovery. Many women may not realize that something is wrong at first, as the symptoms can be subtle or easily mistaken for normal pregnancy changes. However, paying close attention to your body and any unusual signs can make a significant difference. If you notice anything out of the ordinary, such as unusual bleeding, severe nausea, or rapid uterine growth, don't hesitate to contact your doctor right away. Trust your instincts and seek medical advice, even if you're unsure whether your symptoms are serious. When you visit your healthcare provider, they will start by performing a thorough physical exam and asking about your symptoms and medical history. This initial assessment helps guide the next steps in the diagnostic process. A pelvic exam is often performed to allow the doctor to assess the size, shape, and feel of your uterus. This can reveal if the uterus is larger or softer than expected for your stage of pregnancy, which may be a sign of a molar pregnancy. Next, an ultrasound is typically ordered. This imaging test uses sound waves to create detailed pictures of your uterus and can help the doctor identify the presence of a molar pregnancy. The ultrasound may show a characteristic cluster of grapes appearance, which is a classic sign of this condition. In addition to imaging, your doctor will likely order a blood test to measure the level of human chorionic gonadotropin, or HCG. Molar pregnancies produce much higher levels of this hormone than normal pregnancies, so an elevated HCG result can be a strong indicator. By combining the results of your physical exam, ultrasound, and blood tests, your doctor can make an accurate diagnosis and rule out other possible causes of your symptoms. Early detection not only helps guide the best treatment plan, but also provides peace of mind and support as you move forward. In rare cases, treatment may involve removal of the uterus, especially if there is an increased risk of gestational trophoblastic neoplasia, GTN, and there is no desire for future pregnancies. After the molar tissue is removed, your provider will continue to monitor your HCG levels until they return to normal. If HCG levels remain high, further treatment may be necessary. Even after treatment is complete, HCG levels are typically checked for 6 months to ensure no molar tissue remains. For those diagnosed with GTN, HCG monitoring continues for 1 year after chemotherapy. Because HCG levels also rise during a normal pregnancy, your provider may recommend waiting 6 to 12 months before trying to conceive again and can suggest a reliable form of birth control during this period. Common chemotherapy drugs such as methotrexate and folinic acid can be used to treat molar pregnancy, particularly in cases where the abnormal tissue persists or has spread. These medications can help kill the abnormal cells. Additionally, medications such as prostaglandin analogs can be used to induce contractions to aid in the expulsion of the tissue, sometimes as an alternative to or in conjunction with surgery. The primary treatment for a molar pregnancy is to remove the molar tissue from the uterus. This is usually done through a procedure called dilation and curettage, or D&C. During a D&C, the cervix is dilated or widened, and a surgical instrument is inserted into the uterus to remove the abnormal tissue. This procedure is typically performed under general anesthesia. If you found this video helpful, don't forget to subscribe for more intriguing content on rare medical conditions and health topics.